Welcome to the EPP Party Congress here in Bucharest with the Wilfred Martin Centre for European Studies. I am delighted to be joined by Roberta Savli. She's Executive Director at the European Federation for Pharmaceuticals Associations and Industries. Roberta, welcome to beautiful Bucharest. I have to say we have a beautiful view over the EPP plenary. We only have a couple of minutes to discuss some things, but what I really wanted to get at with you today is the role of medical innovation, not just in improving health outcomes for EU citizens, but also in terms of broader EU objectives. So if I could start with you talking about how can medical innovation help in terms of speeding up access and accessibility to the latest medicines?
So actually, when you look at the pipeline of our industry, we have 8,000 new potential medicines and vaccines, which means that we are living in an era of unprecedented innovation. Just wanted to give you a quick example. mRNA technologies, they provided us with the first COVID-19 vaccine, and now they could potentially be used to treat cancer. But we also know that innovation makes sense if it reaches the patients that need it at the moment that they need it. And currently, this is not the case. Every year, we publish a study, and we found out last time that there is a 7 times difference in access to innovative medicines for patients between countries. So in particular, I'm thinking about differences for patients in Germany and here in Romania, where the wait can be up to 2.5 years. Of course, this is unacceptable. We want to have these treatments and these medicines getting to patients as soon as possible. And we have taken concrete steps. Since 2022, we are committed to file for pricing and reimbursement application in all 27 member states of the European Union, no later than 2 years after receiving the EU marketing authorization. And we have done some calculations, modeling, and we believe that this will actually reduce the delays by up to 4 or 5 months in certain countries, in particular in the Central and Eastern European regions. But we cannot do this on our own.
No.
We need to sit together with all the different actors from the member states, HTA bodies, payers, other industry sector, the patient community, healthcare providers. And we have been calling for the development of a multi-stakeholder dialogue forum for a few years. We do hope that the next commission and in the next mandate that we will be able to see this dialogue set up.
So essentially what you're saying is that today we remain a long way away from a European health union, and that we really need a collaborative approach towards this issue. And that brings me on actually to the second point, which I think is very important and which sometimes I think is misunderstood in political circles, is that about the importance of research and development and how that can kind of not just move forward with innovation, but actually make a big difference to broader EU kind of policies. I'd be interested on your thoughts on that issue.
Let me maybe start by telling you a few numbers that probably you don't know about our sector. So the pharmaceutical industry is the biggest contributor to the EU trade balance of the European Union, the biggest contributor. And every year we invest around 45 billion euros in research and development, which means that we are also fostering a system, an ecosystem of small biotechs, university, hospital, academia. We do employ 2.5 million people in Europe, mostly highly skilled. And I have to say, being a woman, with the highest percentage of female employees compared to other R&D intensive sector, one of the highest. So of course, we are a strategic sector, right, for European competitiveness. And if you look back at the end of last century, Europe was the pharmacy of the world. We were producing half of the innovative medicines worldwide. Now the situation has dramatically changed, and we are only producing and developing in Europe 1 in 5 new medicines, 1 in 5 from 50%. So there is a big change. We are hearing more and more about calls from, for instance, the Belgian president of the European Union to have an industrial deal. The Commission President von der Leyen has requested a report on the competitiveness of the European Union. But we are seeing that there are still negotiations by European policymakers going on a set of legislative and non-legislative measures that might going to the right, not the right direction. So the call is really to get things right, things right for patients, get things right for the health systems, get things right for the economy, because we are regulating the way we adopt, the way we research, the way we manufacture medicines for patients for the next 20 to 30 years.
And it's true, even what you say in my own family, my brother-in-law and my sister-in-law work in clinical trials, and it is a hugely important sector to Europe, and one that's probably not properly understood by policymakers. And it's not just, centred in one member state or two member states. It's broadly distributed across the European Union. The final point I'd like to talk with you about today is, we can't have this conversation without talking about the legacy of COVID. But actually, it's been, from an economic point of view, it's been an incredibly diverse and difficult couple of years. We have the legacy of COVID, we have, the cost of living, energy prices. So I'm just wondering, how can we keep policymakers' eyes focused on health innovation? How can we make our health systems kind of more resilient as politicians and policymakers have to cope with all these different kind of agendas? What do you think should be the real kind of focus area in the years ahead?
So if I actually think back at what has happened over the past 5 years in the last mandate, I feel that for the first time we have really discovered the value of health and the value of innovation. And this was due to COVID, as you mentioned, right? For the first time, COVID pushed us to realize the importance and the impact health has on our economy, but also the value of innovation as such. If you think that only 1 year after, actually not even 1 year after the proclamation by the WHO of the world pandemic, we managed to get the first vaccine in Europe, right? At the same time, you were mentioning the cost of living, the energy crisis, the outbreak of wars in the wider European region. All of this has indeed increased the fiscal pressure on health systems. And we are hearing more and more the need to have budget cuts, right? So we need to change this perspective. It is time actually to start thinking at health and innovation in health, not simply as a cost, but rather as an investment. And I wanted to give you another concrete number.
Sure,
so if you actually look at the advancement of treatments for hepatitis C, in the long run, they managed to have savings up to, for Romania, 45 million euros. And in my home country, Italy, it's 65 million euros.
Yes.
So again, investment, not a cost. And maybe because you were asking what could be and what should be the future, we hope that the next commission will be able to adopt an industrial health strategy, a life science strategy that encompasses all different aspects. You mentioned clinical trials. Clinical trials should be part of this strategy as well. A strategy that would be able to harness the potential of innovation for patients, to strengthen the resilience of the health systems, and also to boost our economy and the competitiveness of our sector.
Roberta, thank you very much. I think what our discussions today have shown is that further collaboration is needed between policymakers and the pharmaceutical industry as we go forward. Please tune in to our social media channels at Wilfred Martin Centre for European Studies over the next 2 days to gain insights into all our interviews. Thank you very much.